Hello, everyone. Welcome to the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade. I'm a naturopathic doctor, and I'm very excited to be joined today by another one of my naturopathic colleagues, Dr. Jill Crista. Dr. Crista is just a force to be reckoned with in the complex chronic illness world. And Dr. Crista, if you don't mind just giving a quick introduction to our listeners, that would be much appreciated.
Sure. I've been a naturopathic doctor for going on 2 decades, which is wild to think about. And I started in primary care practice in southern Wisconsin. Found myself here in heavy metal country in the Rust Belt and Lyme country. And when a bunch of Lyme patients weren't getting better, discovered mold. So that was kind of my work into this, working backwards, so to speak. And I just have a huge passion for helping to elevate the wellness of the planet by elevating the wellness of the beings on the planet. And for a lot of us, the chronic illnesses are due to the planet being sick too. So a big part of what I'm trying to impress on people is as soon as you start to feel better, turn your health out onto Mother Gaia, Grandmother Gaia. Yeah.
That's a beautiful sentiment. That's great. So I kind of just was going to ask you about like how you got into treating patients with complex chronic illness, which you've kind of touched on there. So did it like where you said you're in heavy metal country, so to speak. So was it ultimately that you just started seeing patients who were having a lot of chronic health maladies, and then it's like, okay, let's look at heavy metal issues, and then that got some people better, but not everybody all the way better. Then you got into the chronic infections that got more people better, but there were still some, and then mold was the next frontier. Like, was it that kind of evolution?
Yeah. And I'm also a mom of twins with PANDAS. So, and from congenital Lyme, even though I didn't know I had Lyme disease. So Lyme Bartonella.
Surprise.
Yeah. So, fibromyalgia. Oh, we all have aches and pains. Just pull yourself up by your bootstraps, that kind of stuff.
Great life advice.
Yeah. And from a good Scottish family where, we just get stuff done no matter what. And we're tough and all of those things. So it was the perfect recipe for having kids with Lyme and not knowing that I was sharing more than my sense of humor.
It's good to pass on the good things, but not so much the not so good things. Yeah.
That's right.
Great.
Yeah.
In terms of, and actually one of the questions I have on my list here to ask you is about heavy metals. And so where I to my understanding, you work with folks outside of your geographic area, like you consult on cases for folks far and wide, I believe.
Yeah, nowadays, I mean, that's the thing is I started in the Rust Belt and doing all the things that we're trained to do, cleaning up diet, lifestyle, nutrition, using herbs to fill in the gaps for things. And then I started seeing this trend and like, wow, everybody has, with these kinds of things going on, has high blood pressure, vertical ridges on their thumbnails, couldn't sleep, fatigue, a little bit of like cognitive issues. And I'm realizing as I'm putting it all together, I'm like, this is homeopathic plumbum. Because of course I was trying to treat it homeopathically.
Sure, yeah.
And then also seeing like the mercury side of it as well, which are the 2 biggest ones that I was seeing in practice. And it started to click with me. I was like, oh, maybe it's not the homeopathic, because could all these people need the same remedy? That doesn't make any sense.
Mm-hmm.
And realizing, oh, okay, I have 2 lead mines an hour away, each different direction. This is lead toxicity. And especially with menopausal women, as they were starting to turn over bone and they were starting to free up all this lead, all of a sudden you see these spikes in blood pressure and you see hot flashes and all that stuff. Mm-hmm. So that kind of led me into the, the way that the universe works is it's time for you to learn about this condition. And so it sends you patient after patient after patient with that thing, so that you can get really good at it. And so I just plowed through all of those things with the heavy metals, the food sensitivities, and I remember getting into the Lyme world then, because I had done all the things and people weren't responding the way I would expect. And that's when we get into the chronic and stealth infections, because they can just low lie under there. And it's almost as if the stronger you get your patient, the stronger you're getting the bug as well. And I was seeing that pattern and I was just like, I don't understand this. And then realized it was Lyme disease through a few coinkydinks, sitting at a conference and going, oh, that's my patient. I didn't realize that's what Lyme was. I thought it was an achy joint thing.
Mm-hmm.
And here it's all these other things. And this was back in probably 2004 or 5. And, the chronic EBV. So I thought, okay, those guys got better, but then there's this group that didn't. So we just kind of worked through it in those ways. And as I got more educated in Lyme, I became a ILADS trained physician. And it's just that ever evolving thing that happens as you open yourself and you invite to help other people. The universe will send you a whole lot of certain conditions until you get good at it. And then you move to the next one, then you move to the next one. So the more willing you are as a practitioner, for those listening, if you're kind of a little overwhelmed, you may want to be really clear about what you're saying to the universe that you're willing to do.
That is fair.
Yeah. I got a lot of schooling. They say the teacher arrives when the student is ready.
Mm-hmm.
That hasn't been my experience. Mine has been the teacher showed up early for class.
That's well put. Yeah. That's there's some of us that can identify with that out there. That's well put.
So kind of going back to your original question, then, each of these things you kind of get known as the person who treats the complicated cases. Then people come to see you from outside of your area. And that has just kind of grown and grown and grown. And until the point where now I only do consultations with practitioners, because I'm now in the phase of my practice where I want to teach more doctors how to fish, because that's going to only help more patients.
That's awesome. And I want to ask you about that aspect of things, so that folks listening can, if they want to have their clinician consult with you, or any clinicians listening want to consult, I'd like to circle back around to that at the end. And I do want to ask you a question about heavy metals, but there's another question that's come up in the meantime. So I'll ask you this one first.
Go for it. So, I'll take whatever.
Fantastic. Thank you. So kind of like evolution wise, so, metals, vector-borne illness, mold, what was the next one beyond that? What was the next one beyond that? I'm just curious, mostly because I want to make sure I'm not missing anything in my knowledge base, but also I think listeners would be interested to know, what are the other kind of big milestones, I guess, with expanding your understanding of these complicated cases.
A lot of it boils down to environmental, and we keep evolving to find more problems because we keep inventing new things that could harm us. No one knew lead was going to be a problem. They thought this was a wonderful solution to make sure that color stayed on things that were hard to keep color. Right? Wow, what an invention. Yeah. Or to combust gas, so there's all these things that they were used because it was a good idea for the innovation without really realizing there were health issues. We've got that problem now with Wi-Fi, EMFs. We've got that problem with pesticides and herbicides. It's killing our bees. So, the bees are pollinating most of what we eat. So if we really like food, we should probably pay attention to that. And I think now we're evolving to the next level where emotions are the new toxin of our time. It's going to be the thing that people really have to realize that things like judgment, and that's judgment of self usually is the biggest one we're judging. Some of those emotions, that is going to be because we can get more information now about all the physical things. Go on social media. You can get all kinds of diet advice and SIBO advice and, Lyme advice and all that kind of thing. And podcasts are amazing. So there's so much information available to us. So now it is discernment of all of that for what is it that applies to me. But I think that the next level and what I'm now getting trained on to help people with is more the emotion, energetic side of things. I think frequency medicine is going to be the future of medicine.
I've heard some other very smart docs say the same thing. Like
scalar energy therapy is amazing. It's SCALAR. It's looking at the sun, certain pictures that have a certain wavelengths and things like that, just looking at it for periods of time transmutes medicine to us because our bodies are solar powered. We've always had a relationship with the sun, and so many people are stuck inside. Like this kind of stuff is really cool, and it can be so simple and so beautiful, so elegant.
Cool.
Yeah.
Is there
So look into Scalar.
I was gonna say, is there like do I just punch that into a search engine, or is it
I'll email you some information. It's still very woo and very out there. Like the frequency medicine I've used in school, and I was just very lucky that Dr. Judy Fulop, who was my the practitioner that I followed. We have secondary, primary in the way that we're trained. She was my primary, I was the secondary, and she introduced me to this amazing, miraculous machine called frequency specific microcurrent. That thing, there's a little bit of magic. I mean, there's a lot of things that we can understand about how it's working, but it's sort of like homeopathy. Like homeopathy, I would put in the frequency medicine place. It's been around forever, but I think it's also going to be a big thing in the future of medicine. I think it's going to get its day. I think it's coming now that we're understanding things like nanoparticles and quantum physics and quantum medicine. So frequency specific has been the thing that I've used as my woo medicine in practice, because it's just incredible.
Yeah, I know some clinicians find it to be so helpful, and yeah, that's great. Actually, my first podcast guest, he's a local chiropractor, and they use it all the time. So they're big fans. But
and it can go so far beyond musculoskeletal problems.
Oh yeah. 100%. Yeah. I feel like
I use it for
is just like that's just the sampler platter, and it's like tapping into the full potential.
Yeah.
Well, circling back to the heavy metal question, and we'll circle back to lots of things, I'm sure. Lots of things will be orbiting around each other by the time we're done, I think. So with the heavy metal side of things, where, when you're consulting on cases for folks who are not, living next door to a lead mine, I'm wondering, kind of on average, how often do you find that elevated heavy metals are a significant barrier to folks getting better? Like, how often is it that, like, oh yeah, the patient's done X, Y, and Z, and they're still not all the way better, and the heavy metals are, a big part of them not getting the rest of the way better?
A little tough for me to answer, because now I don't have the same selection bias as a primary care doctor, now that I'm like the chronic illness, mold, Lyme, PANDAS person. So my selection bias is probably a little skewed. But when I think back to before people knew that's the stuff that I did, and I just got to see regular people, I would say that it's a stumbling block for quite a few. I would put it over 50%. People don't realize that it's the stumbling block. They think it's something else. They think it's magnesium deficiency.
Right. And sorry, that's for the general public.
You're saying.
Okay.
Heavy metals are a big deal. They're just not, but now that has gotten squashed by adding all these other things that we didn't have to deal with before. Wi-Fi being the one. Carrying a cell phone, in your pocket or in your breast pocket or in your purse, having it by you when you sleep. That's a whole new toxin of our time. That's electro pollution. So what's happened is that, does everyone deal with heavy metals? I think over 50% of people really do. But now that's gotten this other heavier thing on top, which has also gotten this other heavier chemical on top by having pesticides, herbicides, fragrances, VOCs, all these things. So now heavy metals seem less significant, but it's just because they're not able to be discovered until some of that top stuff gets peeled off. Yeah.
So once the top stuff's peeled off, how often would it be that, patients plateaued on X, Y, or Z symptom, various layers have been peeled off, and then eventually heavy metals are dealt with? How often would it be that the heavy metals would, say, propel somebody like an additional 25-30% plus, further in the right direction, in terms of feeling better?
That's a great question. I would love that data.
Wouldn't that be great? Yeah. We won't hold you to the exact number. You don't have to cite the PubMed ID. And if you wouldn't mind kind of answering it within the framework of patients who are dealing with complex chronic illness, because that's the main audience that we're speaking to.
I would still stay in the higher than you would think, 35 to 45, 35 to 50%.
Okay.
And timing is very important. So if EMFs are a real problem, they have heavy metals. that is changing the current and the dynamics of how those heavy metals are impacting them. They're not just like I won't say, that lead is innocent, but it's not just like innocent lead sitting around in a bone. EMFs are now saying, ooh, I'm going to hyperpolarize some membranes. And now if there's mercury, lead, cadmium, tungsten, gadolinium, all of these things, they're like, bing, kind of like a magnet on there. Mm-hmm. So I think they're more a problem than we pay attention to because we've got all these other things we're trying to deal with. Mm-hmm. But in the complex chronic illness patients, heavy metals are a bigger deal than I think people are talking about. So I'm so glad that you're asking about it. And the way that I do this with the treatment of it is very different for a complex chronic illness person than like, I have one patient that came to see me, healthy as a horse. She said, I just don't have the pep that I used to have. And her blood pressure was going up. And for her, she was a very healthy person who had gone into menopause and started freeing up a bunch of lead. And we just needed to chelate that out. And she got her energy back and she was able to lay down more bone. Her osteoporosis improved. There's healthy people walking around with this stuff. Mm-hmm. That was like a concentrated chelation that we were able to do. But in the complex chronic illness patients, I pulse that in just very selectively and very carefully. So they may be on like a chronic antimicrobial. And then what I listen for is the thing, again, I look at the homeopathic materia medica to really describe for me what metal we might be dealing with. And sometimes it just doesn't matter. Like Quicksilver has the EDTA liquid that has multiple ways to grab things. And so when people get to that stuck point and I start thinking in my head, biofilm, well, part of biofilm is heavy metals. So it's not just the enzyme piece, but also just toss in a little EDTA and see if they can handle it. Mm-hmm. Yeah, which might be taking care of biofilm, but I think it's also chelating.
Yeah, I mean, my understanding is those phase 2 biofilms, they're so tenacious because of the metal components to them. So yep. Yeah, it's
a matrix.
Yeah.
Mm-hmm.
And this is a perfect time to remind everybody that everything that I'm discussing with Dr. Crista is for informational purposes only. We're not providing any medical advice in any way, shape, or form. Mm-hmm. Please speak to your personal healthcare provider about making any medical decisions for yourselves. One thing I just want to yet again circle back to is just something that Dr. Crista mentioned there, where you said that, I'm paraphrasing a bit, but where the Wi-Fi, EMFs, these, ultimately dysregulate our membranes in our bodies. That's our cell membranes. That's our mitochondrial membranes. Everybody that's listening to this probably knows how important mitochondria are for our overall cellular physiology. And that, as you were saying, Dr. Crista, it can really interfere with the body's ability to keep those toxins at arm's length, as far away from the crucial parts of the cellular structures, different parts of the body as possible. And I think that concept, like you put it very simply and I think really succinctly, because I think a lot of the times folks think about like, oh yeah, like Wi-Fi and EMF exposure, like it's kind of this like bit of an ethereal kind of thing. It's like, how is it really affecting us? Is it really that big of a deal? It's like, yeah, like we have the published evidence that it definitely negatively impacts our membrane integrity and for all intents and purposes makes us more of a sitting duck for those other toxicants. So maybe mm-hmm. you go, back, 300 years, person's, living on a pristine Hawaiian island and somebody puts a cell phone tower beside me. If somebody from the future, comes back, builds a cell phone tower beside them, they might be just fine. If they're just getting bathed in 5G or 4G or whatever it is, maybe it doesn't really matter that much, but bring that into contact with modern day folks dealing with all the stealth infections and the mold and the metals and the, the negative emotions and all of that. And man, oh man, like it's just synergizing things in the worst possible way for us. So mm-hmm. I think that's a really great point that you brought up, that it is really, really important to address.
Thank you for explaining that for people too, because sometimes I get on a roll and I say things like hyperpolarized membranes and people are like, what does that even mean? So thank you for making that understandable.
I'm trying to channel the better health guy because he's so good at doing that. Like he's sort of like pulling people back in. Anyways, if you're, but thanks for the feedback. On the EMF level or on the EMF side of things, are there, aside from just minimizing exposure, are there any devices, like there's different devices out there that claim to neutralize EMFs or different things, like, you know, Dr. Klinghardt talks about all these different gizmos and, you know, special paints that you can paint on your wall and sleep sanctuaries and all these different things. Are there any, aside from minimizing exposure as much as possible, are there things that you recommend for your patients, or treatments like internal or external things that they can do to help mitigate their EMF exposure if they can't get away from the EMS as much as they ideally would?
Yeah, I don't have a whole lot of science on a lot of things. There's a lot of really cool devices, but are they actually working? And I haven't played with enough with my EMF meter to see, like, to speak to the full thing, you know, the Faraday cages and that. But I think where you sleep is really important. So having those sleep curtains, you know, I think that that's a really big, especially if you're in a apartment building sort of situation and you're in a work building. So all day you're exposed during your work to having Wi-Fi and maybe multiple Wi-Fis because of different offices having their own. And then to come to your home, if you're in an apartment situation or a condo situation where you have it all around you in a city, that's pretty hard on bodies. And we will evolve to handle that. And the way that I'm working with my patients in the energy shamanic realm is to say 5G, yes, please. Because we're electrical beings. Imagine if we could actually use that to fuel our system. We're not there yet. Not everybody is. Some people are doing this, you know, and are actually getting energy from being exposed to it because they're using a lot of techniques to do that, harmonizing with it, we might think. But we're not there yet. Most of us are not, you know, monk style people who can deal with that. So I think that where you sleep is a really important place to protect, but also absolutely 100% have to get outside and ground with Mother Earth. That is, if you look at the EMF, the bad wiring, if there's bad wiring, bad grounding on a wiring system, it will have dirty electricity that will emit more EMFs. And if you think about what that means, bad grounding, you know, if we're really not being good about a daily practice of grounding at the original charging station, you know, Mother Earth is the original charging station, you're going to be more affected. So I have patients who do live in an apartment building situation with multiple Wi-Fis, who do work in offices that have Wi-Fi as well. The park they go to have lunch in New York City has free Wi-Fi, public, you know, I mean, it's all over the place, but they have a very dedicated grounding practice and are really not, I would say, and I don't want to just do an N of one. That means everybody, that means it applies to everybody. I've just seen it over and over and over again when I say, I can't impress upon you enough how important this is, that it's not just being out in nature, it's appreciating nature. It's having it, it's like giving your heart to nature, which means things go this way. And then the energy can come back to you. If you are in fear, fear is a very involuting emotion. And fear invites then coming in with that electrical current, heavy metals, toxins, you know, things to come in and to be magnetized in. So I think that it's got to be daily, work it in. It's more important than any supplement you can even imagine. And we can't bottle it because it's energy. And I just said frequency medicine is going to be the most important medicine in the future. It's now. So I think a daily practice of grounding and then protect where you sleep are the big things.
And just to emphasize a little bit more, or expand a little bit more on protecting where you sleep, like that would be turn off your, you know, Wi-Fi router if you can. Make sure you don't have any electronic device, like everything's on airplane mode or ideally just turned off. Are there things like, do you recommend people create like a, you know, canopy bed, sleep sanctuary?
Some people need to. Some people do need to. And not just having it off, having it out of the room, because what we're finding is even when they're off, like mine is off right now because this is pinging, quietly pinging away.
I see.
That's crazy. Like
Yeah.
they're supposed to be asleep. They're not sleeping. When you turn it off, they're not sleeping. The only way of sleeping is if you take the battery out.
Hmm.
So that needs to be out of the room where you sleep. And I've had patients actually have static shocks that we couldn't figure out. We were doing all the EMF stuff. So, and I'm very lucky that I have an incredibly skilled indoor environmental professional. The Bow Biology, BAU, Bow Biology out of Germany. These people, the BBEC is their credential. They're paying attention to EMFs. So I was like, static shocks are associated with mold, so let's go do an assessment. Well, it turns out this woman had an outlet when they pulled her bed frame away from the wall. She had an outlet right on her head, right behind her head when she was sleeping. So paying attention to where your bed is in relation to those things too. And you can get an EMF meter really pretty inexpensively, or you can, hire someone to come in and check and make sure the whole wall up and down where you sleep is not emitting dirty electricity, because that alone could be causing problems, whether you're out in a, in a no 5G, no Wi-Fi area, if you have, bad grounding, wiring that isn't done well, or where there's electrical wiring and then a water pipe going by. These are all factors that can be changing the electrical current.
For the Bow Biology folks, do they where are they located geographically, or do they do distance consult?
All over the place. Some do distance consultations. I know the one that I work with, Martine Davis, she's in Madison at airinspector.com. She does some distance for some kinds of things, but I don't know if, EMF, I don't think you can do, you really need the meter. But they may be able to mail you the meter to check your house and give you instructions on how to do it.
Okay.
Yeah.
Yeah.
So some of my patients, we've done all the mitigation stuff, Wi-Fi off, devices out of the room, all of the things that we could think about that are easy, those are pretty easy things to do. And in some cases, they just really needed the added protection.
And just an additional plug for Martine at airinspector.com. You passed on her name to me years ago, and I've referred so many patients to her. And yeah, she does, where I'm in Canada, but yeah, she does distance consultations. Just it's great. We had some water damage at my clinic, unfortunately, a few years ago, and it was all just taken care of via Zoom consult. She mailed us the material we needed to test. It was really, really great. So if you're if anyone listening, if you're like, oh man, there's just no IEP in my area, what am I going to do? Some companies, not all of them, because I've asked others, and not everybody's willing to do things distance wise, but there are some that will do that, which really cuts down on cost. Thankfully, so buy somebody in. So
absolutely. And we inspect, they have what's called the mold finders method. So if it is mold, and it's not the EMF thing, but because they focus strictly on mold, which is nice because they're really good at what they do. If it's mold, they have this whole school. Basically, they teach you how to inspect your own house, and then they'll work with you to get the sampling done.
It's great.
It's a really cool resource. Yeah.
Well, I'm going to include those websites in the show notes. So for folks who are driving or whatever and not able to make these
right.
notes,
that's so nice. I know. I do that with the podcast. I've got chicken fingers or something. I'm like, oh, I got to write that down. And then I remember, oh no, that's going to be in the show notes.
Yeah, absolutely. Show notes are key. Well, kind of tying one of the questions I had for you into what we were just talking about there. So if a patient has, we'll say, ongoing mild to moderate mold exposure in their current home, and they're unable to remediate or move, are there sort of damage control methods that you found that can at least, either work well enough to keep the space livable, or if say they're like, I won't be able to move for a year, I can't break my lease, or I have to save up the money, or whatever it is, I can't remediate, just due to financial reasons or logistical reasons, are there things that you recommend that they implement to kind of damage control the ongoing mold exposure in their environment?
Yes, this is very common that people are stuck for a little bit. And I tried to say they're still in mold instead of stuck in mold because it has better energy.
That does have better energy. I'll make
Yeah,
that mental
I
adjustment.
know. I'm just,
Thank you.
but people resonate with stuck in mold, I mean, but I'm always like, okay, we're just gonna take that word and we're gonna say you're still in mold because there is the whole message is you must get that either remediated. Like you can't get better if you're exposed to mold, period. If you've already been made symptomatic from it, you cannot get better if you're still in mold. So that said, there are a lot of things that you can do. I have a whole course on it. It's an hour-long course called 9 Things to Know If You're Still in Mold. There are some dietary things you can do, such as if we understand what mold is trying to do, it's trying to move in and compost you. So we want to make sure that we're not reinforcing that with the diet and the supplements that we're taking. The message in those toxins that mold is spitting out is fungi is trying to move in. Fungi is trying to take over. So we want to look at the whole fungal family and find out, are you eating any of them? So anything yeasted, that would be yeasted breads, nutritional yeast on popcorn, beer, any of those things, gotta go. Aged cheeses, where we're going to have more bacterial, possible fungal can come in, like a blue cheese. Getting rid of mushrooms, getting rid of anything in the fungal family, medicinal mushrooms, just during that period while you're in that exposure. We don't want to reinforce the message that mold is trying to move in, because that will aggravate particularly neurological symptoms. Then also reducing the things that can grow yeast, because a lot of people who are exposed to mold easily end up with a yeast overgrowth as well. Even though molds and yeast are a little different, they're real close cousins. And then that can affect your brain function. We've seen lots of studies that show that if you have yeast overgrowth in your gut, it's actually affecting the microglia, the immune system of your brain. And I've seen in practice that yeast really goes to the brain. It really affects anxiety, sense of despair. Out of all of my patients who are dealing with mental health issues, the yeast overgrowth people are the most likely to have suicidal thoughts, because I think yeast just goes there. It really affects how you think and how you feel, So we would do things that don't promote the growth of yeast, which would be kind of an anti-candida diet, getting rid of the sweets, like no juice. Nobody needs to be drinking juice. There's no reason for juice. If you need fruit, have the fruit. So you get the fiber and the pectin and the binding from that. And then things that tend to have mycotoxins in them. We see a lot of mycotoxins in corn, soy, peanuts. And if somebody's really sensitive, then we would also look at some of the grains, also potatoes. But a lot of times, if you can get those that are organically grown or local, especially if they're in season, and or if they've been frozen foods tend to have less mycotoxins because they're processed right away. They're not sat around waiting for, somebody to make it into polenta or something like that. So that would be the dietary stuff. And then using high fiber. Insoluble fiber has been shown to pick up bile, and bile is what packages up the toxins from mold to carry it out of the body. So we want to pick up as much as possible. And just using high insoluble fiber foods, I have patients do the seeds or bran that's really high in insoluble fiber, like flax seeds, chia seeds, psyllium husk, bran. If you have problems with SIBO and you can't do those, you can use sunflower seeds, pumpkin seeds, sesame seeds. Those 3 are perfectly safe on Dr. Nirala Jacoby's biphasic diet. The first phase, it's most restrictive. Those 3 seeds can be used. And so just grind them up so that they're the finest they can be, so you get more surface area. And I have my patients use 2 to 4 tablespoons of that a day, just to get that binding taken care of. We've seen studies that insoluble fiber is a very, very good bile binder. You don't have to make it hard on a lot of binders, the clays and the charcoals and the if we bind you too aggressively while you're in mold, the body will be like, oh, we're in detox mode now, not accumulation mode. So let's dump a bunch of stuff. And then you get more symptoms. Air filtration is really important. I have a favorite air filter out there. It's called the IntelliPure. You can see on my website, I have a whole video of like questions you should ask and consider. And on there, I have a very short 1-minute video that I pulled out from that longer video where we do a particle comparison of the other air filters that are out there. And it is stunning that when we test the particle count coming out of this machine, it's zero particles. And it's the ultrafine particles that carry the toxins around in the air. So if you can get your particulate count down, then those mycotoxins, even if they're getting poofed into your indoor air, they will stay more on the paint and on the wall. And you can actually do essential oil scrubbings of the walls to reduce your count. But if you get your particle count down, there's nowhere for that to come up into the air and into your respiratory passages. I'm also a very big fan of, and IntelliPure, I get a lot of questions. People are like, well, what about IQ Air? What about Austin Air? Those also pass the particle count primarily. Air Doctor did not. But their filters can become petri dishes while you're still in mold because it's in the environment of the biofilm. So IntelliPure is the only one that zaps the filter so that can't happen. It creates a biostatic environment. Essential oils. So there are essential oils. They're on my YouTube video, the DIY essential oil nasal spray. I have all the essential oils that have been studied for not only combating fungus, but those that shut down the fungus's ability to make mycotoxins to defend themselves. So that's a really handy tool when mold is trying to grow and trying to spit out mycotoxins. If you have essential oils in that environment, it reduces the most toxic part. So we don't want to spray because we're adding moisture to the problem. So I have people put essential oils on cotton balls and place them around into the most affected areas. So those are just some ideas. Things you don't want to do, heavy breathing exercises because you're in mold. Right? I mean, people are saying, for your vagus nerve, take a deep breath. And your brain is like, don't take a deep breath. So you're fighting with the wisdom of your body. Taking glutathione can really aggravate people when they're in mold as well. So we try to use the things to help your body make its own, if it needs it, so that we don't push the body, that accumulation detox thing. We don't want to push the body into detox. And then there have been lots of things studied in animals where they know they're going to be in a moldy barn and that are, if you pre-dose, are protective. Things like milk thistle, DHA. These are things that we know quercetin will help protect the body. And it's something that I nag all the remediators in my area about because those respirators do not block mycotoxins. So these guys doing this life-saving work are putting themselves in peril. And I'm like, the research shows, take this stuff in the morning and it'll protect your liver and your kidneys and your genes and your cells throughout the day. So that's all laid out in the course, really detailed. And I give doses and stuff in the course.
Awesome.
Not to do a commercial. I'm just trying to, I created it because I had some of my members were like, what do we do? And I'm like, oh, is it different if you're in mold? And I thought back to my patients and I was, oh, definitely. I've definitely made people sicker, trying to do good things.
Right. Yeah. Well, thanks for mentioning those resources, and I'll link those in the show notes as well. Sure. And I haven't done those particular courses, but I have done your full clinician training course, and it's like second to none. And I tell all of my colleagues about it. So I can't imagine that these courses for the general public would be anything shy of that. So definitely worth checking out, folks. Just a couple of just little notes on a couple of things you mentioned. Just the IntelliPure, one of the only air purifiers, maybe the only air purifier, I don't know, that's actually made in the US of A, believe it or not, unless something's changed in the last couple of years. So just FYI, if you care about those things, then it is made in the States. And the other thing, and I'm just not sure if you've seen these before, but there are some essential oil diffusers that are completely water-free. So they're expensive in my experience, but there are some options. So if you don't want to do the cotton ball method, there are some fancy pants ones that can be used.
Yeah. And even the old school one, with the sticks, Target, I've sent in our area because it's the easiest thing to find. I send my patients to just go get that, it has to have a small mouth, and then, some kind of a open bottom, but you could just stick bamboo sticks in and that will carry the essential oil up as well. That's the old hippie way to do it.
Right. I've seen those, never used them, but
they're great. Oh, they do. They draw the essential oil up to the top and then that it volatilizes. But you
Mm,
do have to have some sort of like a little bit of air movement in the room to have it volatilize.
gotcha. Well, one other mold question, if you don't mind. Let me just bring it up here. So if you have a patient, or say you had a room full of 100 patients, heaven forbid, you're 100 patients all at once, that would be a little overwhelming. So 100 patients, they've all been, they've all been exposed to mold. They were still in mold for a while. Now they're no longer still in mold.
Nice language.
Yeah, I'm just trying to ingrain it here, and they are still symptomatic. So they've been out of mold for 6 months plus, let's say 3 months plus, whatever. They're still symptomatic. Of those 100 patients, roughly how many of them would you say it would be crucial or highly, highly, highly important to use some type of a nasal spray to treat their sinuses, like with antimicrobials? How often would you say out of those 100 patients would it be crucial for that to be done?
100%.
100%. That's a high number.
It's a very high number.
Okay.
Yeah. So this is from occupational studies where we really have actual humans. This is not on the treatment. So the treatment comes from my empirical experience, but the cause is from real human studies, occupational studies where people were exposed to a moldy building. And this was 4 studies over 7 years. And they did a review. So they took all of that data. And what they find is that 50% of the people who had that exposure, their symptoms went away either the minute they got out of the building or by the end of the weekend. And then they would start over again, be symptomatic in the building, but not when they were out of the building. Those 50% needed no treatment when they did good remediation. There's 50% were symptomatic still out of the building, and the worst ones were the ones that were symptomatic throughout the weekend and were still symptomatic and then had to go back to work again. Those people had chronic respiratory issues, chronic fatigue syndrome, sick building syndrome, gut issues, like boom, 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 you name it down the line. What I learned from Dr. Joseph Brewer's study in 2013-14 was pivotal in why I've added this as a critical part of treatment. Because what they found is, lo and behold, when you test healthy people and sick people, we all have fungus in our sinuses. So it's the mere presence of fungus is not the problem. We all have bacteria in there. We all have all kinds of things living in our sinuses. The difference is the healthy people had no mycotoxins in that washing, and the sick people did. And they tested nasal, lung, gut. I believe they took a biopsy of brain as well, but they had taken biopsies of lung. I know.
I want to sign up for that one.
Yeah, exactly. And they found mycotoxins in all of those tissues.
Wow.
Which is, what does that mean? That means your own flora have now either started making them, which a lot of times we see with candida overgrowth, and or mold has moved in and you are now colonized, and it is a war zone now going on your respiratory, your mucosal, your skin. Oh, skin also. We all have fungus all over the place. We all have an aspergillus spore that makes its way to our lungs, and then our body eventually fights it off and gets rid of it. What's the difference is colonization, meaning your own flora has moved from a commensal microbiome. We're getting very familiar with that word, microbiome. We have a different microbiome for every area. We have a different one for our mouth, for our sinuses, for our ears, for our gut. Everything has its own unique microbiome when it's healthy. That microbiome is basically just a healthy biofilm. So what happens is that when we get colonized, it shifts it into not healthy biofilm, pathogenic species, non-commensal, not more opportunistic and that kind of thing. So if this is the seed for every time you swallow, you're swallowing a little snot, this needs treatment. And the way that I approach it is that if we're finding mycotoxins or antibodies to mycotoxins in your body, you still have something in your sinuses that needs to be addressed. And not always is it with like a heavy hitter bag spray. Like I very rarely use the pharmaceuticals. Sometimes I do, especially with chronic Lyme and mold. The sinuses can become quite a resistance area. So that can be a big barrier for people to get better if we don't do something a little more aggressive. But sometimes, even if they don't have any sinus symptoms, do I treat them? Yeah, I do. But it's not always with an anti, it might be with a pro. So it might be with Lactobacillus sacchii or humic and fulvic acid, exact Bush's ion biome, something to help get the commensal species back up again. Some people snort megaspore, the spore-based bacillus. I don't know about the science of that, putting that in the sinuses. I understand the science of putting it in the gut, but I have patients who are like, they swear by it, or they'll put it in their neti, they mix it in their neti and they use it there. So does everyone get some form of sinus treatment? Yes. Might be an inhalation stick, like the Olba's essential oil sticks, which you can probably get in Canada very easily because it's European, especially for kids, because kids, you can't spray things up into their sinuses. They don't have developed sinuses. So the really little ones, you can just do the swabs in the nostrils with these pro things that can help the body rebalance that commensal species.
Awesome.
Long-winded answer.
These are good answers. That's what we're here for.
Okay.
And so just to maybe take that question one step further, but just before I do that, just FYI, I've recommended lots of Megaspore up the schnoz for patients over time.
Okay.
We had them mix capsules into like little dropper bottles of saline and squirt it as opposed to snorting. It's just a little less like, sketchy, I guess, maybe to not snort things. But it can be super, super, super helpful. So just like sometimes more impactful, as you're maybe alluding to, sometimes more impactful than all the killing sprays and all of that. So sometimes you just need to give a little love and it just goes a long way. So that going back to that room full of 100 patients, so you've recommended some type of nasal treatment for all of them. Of that 100, how many of them would you say that the nasal treatment is, at least, say like 20-25% impactful for them? So like they really notice like a significant clinical benefit from it, like shifting.
Oh, I'd say over 80. Yeah.
Okay.
Like it's huge.
Yep.
Yeah.
Okay.
And what I see, because I did lots of years where I didn't do that, I only treated sinuses if someone had sinusitis. And then read that study and was like, oh, this is colonization. Now I get it. Everybody needs this. What I saw was people would go from this, getting better, getting better, getting better, getting better, getting better, and then added the sinus treatment and, improvement like crazy. So I'm like, why wait now? Why wait? And the typical minimum amount of treatment time would be 3 months. Typical real for chronic illness, people is 6 to 9 months. But not always the anti thing. We might start with the anti and then move.
It's the one advantage of having those evolutions in your practice, because when you learn the next thing, it's like, oh, you go back and then like look at how all these patients have benefited because I didn't know as much back then, and it's a really it's great for the patients when their clinician is willing to learn more and able to learn more, and then it's great for the clinician because you see, wow, like this is just a single variable that I'm applying to all these pre-existing cases, and man, like it's exciting when it moves the needle so nicely in the right direction.
And I felt like I needed to write letters to my patients where I missed it. Like, hey, if you're not doing nasal treatment, come back in, we'll get that fixed,
Nice.
Yeah. It always makes you feel bad when you learn something like, oh, I totally missed that in like 5 people.
Yeah. I've written those emails. I mean, not letters, but emails, e-letters, if you will. And so they appreciate it, so you're thinking about them. So you just do the best we can as we go along.
People need to know that we're always thinking of them. They take up a lot of space in our hearts and our minds.
They do. They do, Dr. Crista. Well said. Yep. So just sending the love out there to all of our patients. It's a beautiful thing. Oh shoot, maybe I already asked you that question. Okay, I'll move on to something else here. I did want to pick your brain. I know we're getting a little bit close for time here. I'm going to just pick your brain a tiny bit about histamine, if you don't mind, and then I'd like to ask you a little bit about PANS and PANDAS, if you don't mind. So just on the histamine level, one of the mast cell activation syndrome. One of the things that I find to be a bit challenging is that I feel like we don't have nearly as many therapeutic options for patients to help stabilize their mast cells or deal with, elevated histamine symptoms as is really warranted, because it can be so very impactful when patients have histamine related issues. So
Mhm.
outside of, finding and addressing the root cause, which of course we're always thinking about, but that doesn't typically happen overnight, mast cell stabilizers or histamine receptor blockers can be really helpful. I'm just wondering if outside of, say the H1 and H2 blockers, outside of some of the better known mast cell stabilizers like chromolim sodium, for example, or ketotifen, or outside of some of the better known natural, like non-pharmaceutical options like quercetin, for example, are there any, shall we say, like lesser known mast cell stabilizers or histamine, kind of more like symptom-based treatments that you use in your practice that folks may not have heard of, and that I may not have heard of?
Yeah. Yeah. I think one of the most underutilized plants for this is nettles.
Hmm.
And nettles blocks H1, H2, and reduces mast cell degranulation.
Mhm.
It's like
Everything.
ketotifen on
Everything.
steroids, except it is a food. So that means you have to take a lot of it
Mm,
and use a lot of it to make a difference.
mm,
So because it's safe, and a lot of these things, like you have to get that threshold, that minimum therapeutic dose, like with milk thistle, as you learned in the class, 750 milligrams daily is what it takes to get that therapeutic dose. Resveratrol, a gram daily to get the blood levels, plasma levels that we're looking for to make the dent. I think nettles has that as well, in my experience. So when people say, yeah, I tried that, I'm like, what did you try? Well, I took a capsule of it, maybe like in the morning and then maybe one at night. I'm like, then
mhm,
you haven't tried it.
mhm,
Nettles are so safe. And in order to get that threshold, you do need to take a significant amount. And there's cheaper ways to do this. You can buy nettles in bulk in the health food store and make tea out of it and just drink it all day. And it keeps the plasma levels up for you throughout the day. It's a very inexpensive way to do it. They're very tasty. I mean, I'm an herbalist, so, to me, they taste yummy. To normal people, it tastes a little bit like grass. But you can mix that with lemon juice. You can mix that with things that also have mast cell stabilizing effects, citrus bioflavonoids in the lemon juice. So I think nettles are highly, highly, highly underutilized. And you don't need to use it that much for very long till you get things downregulated. And
mhm,
then you can use less and less and less and less.
mhm,
So if I'm ever going to add a ketotifen or something like that, and you heard me say this before, I never use a drug without the plant. The plant comes first.
mm,
And then if the plant doesn't work, or we don't just say, well, nettles wasn't strong enough, so we're taking them away and then we're going to do the ketotifen instead or something like that. No, because the plant has all these other things that are helping that we don't talk about. Trace minerals, that's a big one,
mm,
is that goes back to heavy metal toxicity. If heavy metals are sitting in the seat on the bus that trace mineral should be in, that trace mineral doesn't have anywhere to go. It just comes in the body and goes out. So tons of people are trace mineral deficient.
mm,
People who benefit from humic and fulvic acid, trace mineral deficient.
mhm,
Like we know they're predictable things. So nettles are also very high in trace minerals. So you're getting nourishment, you're getting the bioflavonoid folinic acid, which processes out a lot of the mycotoxins, bumps it off of albumin so that the mycotoxin can get out through the kidneys. Perfect, amazing plant. And we don't use it.
mhm,
In kids, I use hops a lot. Hops also is a mast cell stabilizer and histamine blocker. And it's wonderful for babies. This is not in my mold in kids course. I'm realizing I probably should have put it there, for taking a bath in hops tea, because it's also relaxant, it's safe to use on the skin, and it's a mast cell stabilizer. So your kid who just like blows up all red, or if you are one of those people, if you're having problems with and you're doing the DAO before you eat, and trying to take a bunch of Paramin, take a bunch of PEA, and get ready for that meal because you're so worried and you're on that low histamine diet, doing some of the things topically as well, because our skin is an amazing sponge.
mhm,
So you could take a hops bath before. Of course, hot baths can make histamine worse, but tepid, or drink some hops tea. That
mhm,
really helps the people that have a lot of reflux issues, a lot of H2 problems, a lot of reflux issues from after eating. That you can do it, just drink a little hops tea before you eat, and that can help to manage the topical stuff on the stomach lining. Also curcuma. We don't pay attention to this part of it, but turmeric has histamine blocking capabilities. So the lovely thing about that is you're feeding many birds with one seed. It's detoxifying, anti-neuroinflammatory, anti-inflammatory, helps with the joints. So if you have mold, Lyme, and it has some histamine blocking activity as well. Detox, I could go on. Kidney protective. Yeah. So these plants are amazing, but we don't use enough. We don't use high enough doses, in my experience, and we don't trust them. I don't think we have the repetition and the high enough dose to really get our trust with them.
That's fair. Yeah. The dose makes all the difference. I can't say how many times I've consulted on a case and it's like, oh yeah, you're taking quercetin or you're taking NAC, you're taking whatever. And it's like, what, like one capsule a day? Like it isn't going to work.
Not going to do it. Yeah. Right.
Yeah, maybe
and it's so funny. Like
eventually, but
people think, oh, I don't want to take too much. And I'm like, you're taking 2 antibiotics. Like this dose of nettles is not anywhere near the high risk that those 2 antibiotics that you're on is. So go for it. It's a safe food. Yeah. Nettles also is a natural source of quercetin and fisetin and rutin. I mean,
this goes on and
got
on.
them all. Yeah.
With the nettles, would you, like, if say a patient's like, I don't want to drink the tea or I'm too busy or whatever, like, would you be able to see an analogous therapeutic effect using nettle capsules or nettle tincture? Like you can, medium doesn't really, or the form doesn't necessarily matter a whole lot.
Doesn't. No, you're missing out on the mineral part.
Sure.
So, you might need to do the humic fulvic acid with the nettles tincture or glycerin. And I like, there are some formulas where it's nettles as the base and then they add. So it's like nettles is this, and then they might put quercetin in there or something like that. Sure. So you're kind of, upping the ante on that. But I have to say the overall picture, if mold is anywhere in your past history and you have mast cell problems or histamine problems, you have a fungal overgrowth. Mast cells are recruited when the fungi start to try to get through the membrane on your mucous membranes, which is your respiratory passages in your gut, bladder, skin. So once that root goes just that little bit past the membrane, mast cells get recruited like crazy because that means the surface guys didn't get the job done. Those antibodies and immunoglobulins on the surface part. So once it got a root down, mast cells come from the backside. So we know mast cell aggravated or histamine aggravated patients are fungally overburdened and they need that help. And I think a lot of people are like, I was very slow to come to this mast cell activation awareness. I was at a Lyme conference and I heard it, and I think it was Dr. Thea Harides. I'm like, oh yeah, histamine. I've got some patients with pretty bad allergies, and I know you do LDI. And, I was thinking to myself, okay, we might need to do some of that. And then I was realizing, like, talking to their doctors, I have a lot fewer patients who had that than other treating doctors. And I think because I'm pretty aggressive about the antifungals, especially patients on the antibiotics. I don't know about you, but, sitting at iLads, I'm thinking, oh my gosh, we have people on all this stuff and we're not managing the yeast. We're not managing the yeast at all. Now we are, I think, with more awareness, but there were a lot of patients on some serious therapy and no antifungals. So of course they're going to take over. And of course they're going to have histamine problems then.
Yeah. And with the antifungal treatment you're referring to, that would be not just up the schnoz, it would be like systemic antifungals as well. Yeah.
I rarely do one without the other. Yeah, because you're seeding, if it is in the sinuses, you're seeding the gut. But we also know this is all one connected tube. So yeah, I do systemic and intranasal.
Wonderful.
Well, not always drugs.
Indeed. Well, I've got about like 10 questions I'd like to ask you on the mold train, but I do want to very quickly ask you to, because I see we're pretty much at our time here, Dr. Crista, and I don't want to keep you longer than we had previously discussed. So I will pivot to the PANS for just a minute. Just before we do, though, I just don't know if all the listeners noticed that Dr. Crista said you can feed multiple birds with one seed, which I feel like is analogous to, or we're going to say you're, still in mold, not stuck in mold. So just,
Yes, yes.
that's wonderful. I'm gonna definitely adopt that one, because I'm always talking about doing away with birds with one stone, and it's one of my favorite sayings. Like, nope, okay, I'm gonna make that switch. So I'm learning lots here. Thank you for
That's Dr.
thank you
Russell
for that.
Mars.
Oh,
That's I
really?
got yeah, that's not a
Okay,
me thing.
that's not a
That's
you.
yeah,
Okay.
he says you feed two birds with one seed. And I was like, oh, I really like that. Yeah,
Mhm.
that's so much more loving.
It is. Yeah, no, that's great. Yeah, I need to mend my ways here. If there's any about like multiple ways to skin a cat, please let me know what the alternative to that one is, 'cause that's another
I
terrible
know.
one. But just
One
so
of
many
my friends, she
barbaric
says,
ways.
"Oh, I just say it's many ways to bathe a cat." I'm like, "Have you ever bathed a cat?" I don't think the cat really like it. That's not. We need
Yeah,
another. Maybe the cats just aren't part. Pet a
that
cat,
that
maybe.
might be it. Maybe. Yeah, there's probably something good there.
Uh-huh.
Well, Dr. Rista, if you don't mind, I just saw on social media within the last few days that you have a new book out about PANS, and would
Yeah.
you mind just speaking to that a little bit? I'd love to get into a PANS discussion with you, but I know we don't have
I'll have to
time. But
come back.
please,
Yeah.
please, that would be great.
Yeah.
But yeah, would you mind speaking to the new book, please?
Sure. Thank you. I'm really excited about this one as a 22. Well, my kids got symptoms from the classic pan symptoms at about 4 years old, 3 or 4 years old. So I'm almost 20-year veteran on being a mom of twins with this. And because you get known as the person who helps kids who are having trouble, then I saw lots of kids in practice with this. And so I just wanted to share what I learned in practice. And because I had kids with it, I attended every continuing education I could possibly get my hands on. If anyone was talking about pandas or pans, I was there. So I'm not one of the people that is part of the incredible gifted researchers and people who decided the clinical criteria and that group. I'm just a in the trenches doc. And I think because I come from the Lyme world also, I wanted to present a truly integrative way to manage this. It's not one way or the other with pandas and pans. Well, with any of this, it's use whatever tool is going to be right for that patient. And so I have how to integrate what we're using conventionally with what we're using naturopathically. And I think one of the best tools in the whole book is not only it's just like my mold book. I give doses, I give cautions, I give things to think about, how to combine and order. So I have kind of a putting it all together, kind of how I have my peel the orange in the mold book. Because when you're in this situation, your kid's in crisis, you need it to be as simple to find the answer as possible. So I tried to do that. I think one of the best tools in the book is a medication compatibility chart, because a lot of parents are very scared to use some of the natural medicines if they are working with a conventional doctor, and vice versa. If they're really natural bent, they're scared to use some of the conventional things when they really could be useful. They could be really helping your kid. So this chart combines the natural things and the conventional things, and you can find to see if these things are compatible and safe to use together.
Amazing. And where can folks find the book?
Anywhere you like to get your books.
Okay.
So for Canadians, you can get it on IndieBound online. That's where you can get an actual print book.
Okay. What is IndieBound?
IndieBound. Oh, you don't know about IndieBound. Oh, you would like IndieBound. It's like all of our weird hippie crunchy books, but it's they sell in Canada as well.
Okay.
So yep. And the Amazons, the Barnes and Nobles, from my website at drcrista.com. And the ebook is it's done. We just, for some reason, there's a hiccup to have it be available. It was supposed to be available on Monday when the print book came out. And we're working on the audiobook. So people will have for both books, actually, mold book and pandas book.
Amazing. That's great.
I do have the audiobook from my mold book, not through Audible yet. That's what we're working on. But if you are a listener, because mold has wrecked your vision, which it does for lots of people, you can get the audiobook on my website.
Excellent. Yeah, there have been some very compelling Facebook threads. Dr. Crista and I are part of a couple of the same Facebook clinician groups, and I've referenced them multiple times in the past, where it's like somebody's asking a question, and then Dr. Crista just like, just like, how did she know all this stuff, and like just all these like obscure, like, oh, I was listening to like Dr. So and so at this time. It's like, what? Like this pathway I've never heard of before. So, and yeah, just really, anyways,
Mhm.
wealth of information on this topic. So anyone listening who, if you have a family member or know someone who's affected by PANS or PANDAS, yeah, I'm sure it'll be a great resource. I'm going to, excuse me, I'm going to get a copy myself, probably through IndieBound, because it sounds like it'll be my new favorite website.
Yes, I think it will be.
I was excited when I saw it, so I'd love to see your thoughts on the topic in one place, so I don't have to keep
Mhm.
searching keywords in Facebook groups and taking forever to find them. So,
That's what I'm hoping. I mean, the pre-reader, Lauren Tessier, Dr. Tessier, she was a pre-reader, and so
oh,
she wrote
nice.
a little ditty for the back
Oh,
because
great.
she's, really educated in mold, and mold is a big player for pandas and pans. But she just said, I think practitioners are going to really get a lot out of this. So I think I
Amazing.
wrote it very simply, like my mold book. I took really complex things and distilled it down just to the simple. In the mold book, I really disciplined myself to use just the single things that had many, many, many actions.
Mhm.
But I didn't rein myself in as well with the pandas and pans. So it's a little much, but I do have a way to put it all together. And they're just there for trying to match the things for your child, because it can look very, like mold, it can look very different in each kid.
Mm, that's great.
Mhm.
Well, I'm excited to take a look at it.
Thank you.
Um, Well, just before we wrap up here, Dr. Krista, just if there's, folks listening and they're thinking like, Dr. Krista is amazing. I want to work with her, but I don't live within driving distance. And I guess you're only doing consultations now anyways. So, how can folks work with you? What are the steps that they would need to take to get your brain working on their case?
It would be through a consultation with their practitioner.
Yes. Yeah.
And I do have a membership for people who are wanting a little more of just my flavor of things, but they do have to have a practitioner that's manning their case. This isn't the same as clinical practice. But in that membership, you have 2 times a month to pick my brain on anything. We do these live Q&As.
Mhm.
And then I have 2 other meetings a month where we get together on Zoom and we just have a big sharing time where everyone can share what's working for them, doctors that really help them, techniques, websites, resources, that kind of thing. And then we have a forum that's kind of feels like Facebook, but it's protected. So you don't have to have a separate social media account,
Mhm.
and you can talk about things and your insurance company doesn't know. There's a lot of stuff that people just don't really want to share with the general Facebook world.
Mhm.
So that forum I'm on every day as well, and you get my 2 cents on a lot of this stuff. So the membership would be the best way to get more of me. So I tried to figure out how do I do this where I can't take any more patients,
Mhm.
because that gets full. So
Of course. And
yeah.
so if, say, a person's listening to this and they're thinking like, oh, I'd really like my clinician to be able to consult with Dr. Krista on my case, um, is that an option as well, or is the membership
It
based?
is. I had to narrow it down. So the
Mhm.
doctor has to be somebody who has taken my mold training course,
Mhm.
because it makes it so much more efficient for everybody and then less costly for the patient.
Of
Because
course. Yeah.
usually that consultation fee is passed on to the patient.
Mhm.
So that would be one condition. And I just had to draw the line somewhere. I found myself repeating myself. And I was like, they would know this if they took my course. So yeah. So now, just for efficiency's sake, that is one hoop that I do have.
Okay. Great.
Mhm.
Well, thank you so much for taking the time to speak with us this evening. Well, it's
Yeah.
evening right now. I mean, whenever people are listening to this, but and I guess for you, it's probably supper time ish
Yeah.
later out here. But thank you
I'm
so much for
surprised you
taking the
didn't
time.
hear my stomach.
It was very subtle. Yeah, no, it's
Okay.
yeah,
Good.
barely noticeable. It's probably all the nettles, I'm guessing.
Yeah.
But thank you so much for taking the time to speak with me. And yeah, just a wealth of information as always, Dr. Krista. I always learn so much when I'm interfacing you in any capacity. So thanks so much, and really appreciate your time.
Likewise. It's a joy to speak with you, really. Thank you so much for having me on your podcast. How exciting.
My pleasure. Very, very happy to do it. Well, thanks so much, everyone, for tuning in, and stay tuned for the next exciting edition coming up down the road. Thanks, everybody.